Bill.
Hi, thank you, Kevin. Thank you, Sherry. Okay, so my name is Bill Bruce. I'm the CEO at the American College of Occupational and Environmental Medicine. I've been with them for the past 3 years, and it's been an adventure in that organization, and particularly, like all of you, it's been an adventure over the past few months. So just real quick about ACOM, we're the largest organization for physicians and healthcare providers that are focused on providing for the health and well-being of America's workforce. We've got between 3,000 and 4,000 members. It fluctuates because of how we calculate our membership, 17 staff, and about a $5 million budget. So this year, you've all seen slides like this, I know, from everybody else. We canceled our conference, all of our live courses. We had to deal with all of the fallout from that. Like a lot of other organizations, we put up a COVID-19 resource center, which we have been diligent about updating anytime there's new information. Given the focus of our membership, we had the opportunity to really elevate our game, and we've produced so far 10 free webinars on various COVID-19 topics. And I think we've got 3 or 4 more in the works for this month. So that just keeps going on and on. Numerous member calls to action, guidance statements, press releases, and weaving it all together is we have a fairly ambitious campaign that we're trying to get out more in the public eyes of just getting America safely back to work. One of the things OEM struggles with is visibility and awareness, and so we're using this as a way to put OEM a little bit more in the thought process of these organizations that are as they're trying to get their workforce back to productivity. For today, though, we're going to talk about on the association side, the staff side, and I'll share a little bit of sort of our history. Back on the 15th of March, shortly after we canceled all of our events, we went ahead and encouraged all of our staff to work remotely. All of our travel was canceled. Only staff that had specific functions that required time in the office were really allowed to go. We put in place social distancing, face mask guidance, and whatnot. Only a week later, with the state, we instituted the mandatory work from home, except for absolutely required in-office functions, which are pretty rare. And we have one employee that goes to the office to help with hosting of our webinars because we have some specialized equipment there, and a few accounting functions, and then basically making sure that the mail isn't piling up at the door, but otherwise staff are remote. So what's happening now is, next week we go into the phase 3 protocol here in Illinois, which gives us a little bit of relaxation for the state and sort of how people can act and behave. And so we've sort of adjusted our protocol to accommodate that. And then at some point in the future, we don't know when, I'm not super optimistic as to the timeline here, but we will arrive at whatever the new future normal is. Because it's relevant, I'm going to give you a quick little overview of our space. For a 17-person organization, we have ample square footage at the office, so we don't run into a lot of the problems that more densely packed offices are going to have. It is a traditional mix of offices and workstations. Our smallest cubicles and workstations are about 6 by 6. Most of them are over 8 by 8. And all of them have a 5.5-foot tall partition between them. And so just to give you a sense, this is kind of what the interior space looks like. So for us, when we go into the protocol of what we're doing to make people safe at the office, we have a lot going for us that's kind of helping us there that maybe you don't. We could talk about those differences when we get into the Q&A. So just a quick overview. I don't want to go into too much detail on this. I know that we are sharing the entire presentation that we gave to the ACOM staff with everybody on the webinar today. It's available for download, so you'll be able to get that. But just to let you know, sort of what we're covering in ours. When we start this phase 3, we're still sticking with a work from home being strongly encouraged. There's really nothing that we've seen that requires us to draw people back into the office right now, and we have been able to be very productive in our current situation, and I'm very grateful for that. A lot of work went into getting us to the point where we could do that, but that's allowed us to be very lenient in how we proceed at this point. For people who do go, strict social distancing, absolutely no personal contact unless there's a medical emergency is really the only exception there. This is pretty standard. I think that we've all sort of been subjected to this everywhere that we've been now. We changed the space limits in some of the spaces throughout the office. All of our public and common spaces, particularly rooms that we used to think could hold 24 people, are down to 7 or 8. Rooms that could hold 30 are down to 10. Rooms that could hold 16 in a lounge capacity are down to 2 because they don't have the space. And we're putting some additional restrictions on how offices get used and whatnot. All of our interior doors and office doors, with the exception of our accounting office and any place that has to secure legal, sensitive, or confidential information, all of those doors are to remain open and unlocked for the entire time, simply to reduce the amount of opportunity somebody's going to have to come in contact with them. I know that some people would point out that surface contamination is a lower threat vector with COVID-19, but it's still a non-zero risk, so we're playing it safe. Like a lot of organizations, we have an out-of-the-office calendar, a shared calendar where everybody could put their time away from work up so their colleagues can see it. Well, this week we officially converted our out-of-the-office calendar to an in-the-office calendar. So for folks who are going to be in the calendar, we now expect them to note on that calendar that they're going to be in the office so that their colleagues can see and plan around that and know kind of who they may be interacting with and who's going to be there and who's not. We've upped the level of sanitation requirements. This is in addition to the building sanitation that happens on a daily basis for us. We lease a suite in a large office, like many of us do. So we don't have complete control over that. The building provides basic daily sanitation, but within the suite, we've done a lot to think about how people will use the space and how to keep it clean and how to safely navigate in and out of the space as you're utilizing the different resources that are there. When people are in the office, we're requiring them to wear a mask basically anytime that they're not sitting at their desk, or if they happen to be in the lounge having lunch. The rest of the time we're saying that you really should have a mask on, especially if you're not at your desk. We relax that at the desk primarily because of the physical space that we allow for those people, even our workstations, again, with 6x6. And if you don't have somebody that is adjacent to you, we feel okay that somebody can take the mask off for a while they're seated at their desk. So in an office, that's a bit more of an ability to provide some flexibility. Because we are in a shared building, we did provide a little bit of guidance to how people could come into and out of the suite safely from the garage to basically the door of our suite on the 7th floor, requiring a mask of staff, encouraging them to not get into elevators with more than, if they take the occupancy above 2. We have small elevators in our building, or not super small, but they're certainly not huge. And just being aware of how you're using those common space. And throughout the space, we've provided all of our employees with hand sanitizer. We actually were able to get a few gallons of it and use refillable bottles to get that out there into the environment so people could use it. And we have been, and I hear that we're on track to receive some reasonably decent quality, non-medical grade masks that we could provide to people on a disposable basis if they, for whatever reason, don't have one with them that day or were unable to get a mask for their own use. So, I mean, that's just kind of it at a high level. Go ahead and stop that. And, we put a lot of thought into how we're going to be implementing this and the needs of our staff and the health and safety of our staff as we move forward. So we'll see how it works. Again, this all starts next week. So we'll go from there.
Yeah, well, thanks, Bill. I know that, from what I'm seeing, we're seeing that folks that are asking their staff to be prepared to get back to the office as early as July 1st, through not starting to come to the office until January 2021. So, some of those decisions have already been made by executives. So it's kind of interesting that there's not really a standard. So I think we appreciate the conversation of you coming, kind of talking about all these different things and what people need to consider if they are planning to go back to the office anytime soon. But with that, my first question is, what do you feel are the safest conditions under which going back to the workplace will be low risk?
That's a great question. That's sort of the $1 million question right now. Our members and our organization has been tracking the epidemiology and the science of COVID-19 since from the very beginning. And it seems like every week we get a new piece of news that is not fantastic. And the most recent, and I'm now about 2 days behind, so I apologize if somebody has heard more current or better information than this, but the things that worry me and that I think are hard for us to deal with in providing for the safe conditions are that once somebody has contracted COVID-19 and recovered and developed antibodies, those antibodies do not seem to provide universal immunity to future infection. You couple that scenario with the very real possibility that somebody can become reinfected, be asymptomatic, meaning they're not going to show a fever, they're not going to have any symptoms at all that are presenting. And it's tough to really know that they're not going to present an exposure risk to everybody else in the office. So, for me, my comfort level is basically when there is a vaccine or when there is a very sophisticated and complete testing and tracing program put in place, which is going to be something that's going to happen at a state or federal level. From our perspective, we don't have the resources to do something like that. Short of that, we'll have to look at the broader spectrum of how pervasive infection rates are and play the numbers game there. There's a lot that we could do in terms of what we're doing in our offices to make them safer and to make people feel comfortable and safe coming back to the office should they want to. But in terms of us as an organization requiring it, I really think that we need to make sure that requiring somebody to come to the office is not exposing them to unnecessary risk, because the outcome of that is you're going to, one of two things. You're going to lose staff because they don't want to work at a place that's going to require them to go someplace that isn't safe. That's not normally what an association employee is signed on for. And two, you're going to end up having all of the costs related to the healthcare, potentially training new staff, lost productivity. So it really for us, it doesn't make sense to rush to that outcome for what our situation would dictate is a bit of an arbitrary need to feel like we could see them working.
Mm-hmm. Yeah. So, Bill, I've actually now we have a few questions that are coming in, and some of these are kind of related to each other.
Sure.
And I've heard this in my conversations with folks over the last couple of weeks. There are employers or employees that have anxiety over office reopening. They have concerns because they may be immunocompromised or have a family member who is, or they're taking care of their elderly parents. So I guess the question is, what do you do if you have employees at some point, I know you have a lot of flexibility, but that you decide in phase 4 or whatever that it's okay for people to come to the office. How do you plan to deal with those employees that have that kind of anxiety and concern?
Educate them. Make sure that they know what you're doing to reinforce the safety of the workplace. Making sure that you're enforcing those standards as you've implemented them, and that you're very strict about it. One thing that's hard. And in Illinois, there's a great example of this. The governor just a few days ago announced that we're going to go to phase 3 at some future date. And I think it was about an hour later that you started seeing people congregate out in parks and
Mm-hmm.
whatnot. It's like,
Yeah.
oh, I guess we're there.
Right.
And so by telegraphing that we were on the path towards some level of recovery, certain people felt comfortable going out and exposing themselves to more risk, even though they hadn't really reached that point in time. And at a society level, that was hard to police, but within our organizations, it's actually very easy to police. If you set a standard for whatever that in-office protocol is, and people aren't following it, you hold them accountable for that. But you make sure you have a good protocol that you communicate to them very well. And if at the end of all of that, you have somebody that is just not comfortable with it, and they are also perfectly able to be productive in some other fashion, then my recommendation would be let them be productive where they can be productive. Absolutely. Even if I made this point to a peer a few days ago who was from an organization they don't have laptops. They've mostly got desktop computers. And it's like, well, think about the staff transition cost, the health care cost, the lost productivity cost. You know what's cheaper than all that is buying them a $1,500 laptop and giving them a connection to the VPN, even if you have to install a VPN endpoint to get them productive. You could do that. At AECOM, we put a lot of effort, just because we needed to. We put a lot of effort into a digital transformation that fortunately preceded all of this. So when we had to switch everybody to work from home, it was really not problematic for us at all. It's okay, today we're in the office, tomorrow we're not. We didn't have to worry about access to anything. So it was easy for us to make that shift. Had we not done that, then we would have had to bring in somebody to very quickly empower an employee to feel productive someplace that they could be safe. You mentioned the immunocompromised employee or their family member, and that's an excellent point. As the employer, we can have certain expectations of our staff that is reasonable, but we don't really have any ability to control their family environment, their home situation with any degree of confidence that we can ask them to introduce unnecessary risk, even if not to them, to people they live with. And their family is a really good example of that. My wife has a suppressed immune system because of medications that she takes. And so that means that whenever I'm out and about in the world, I have to be particularly diligent about how I comport myself so that I don't bring home additional risk. I would not expect anybody to put people they live with and love at additional risk. And I don't think anybody with the ability to influence that decision should.
Mm-hmm. So, Bill, we're getting some questions around kind of back to the, safe environment. So one of the questions have you thought about what a truly safe environment looks like in the future? If a vaccine would be, if it is a vaccine, would you be requiring all people to have the vaccine, or do you see some other level of enforcement? Or to be determined, I guess.
Yeah, I guess, well, if we could sort of paint the Pollyanna picture of a year or so away or whatever it takes to develop a viable vaccine, that if we can assume that vaccine doesn't introduce separate different health ramifications, then I think it is absolutely within our purview as business operators to require employees to be vaccinated. I don't think that goes with, you wouldn't have this conversation about a great many things for which there are vaccines. And I don't see this as being different with the assumption that a safe and workable vaccine were to become available. So that would be the gold standard. If somebody, were resistant to get a vaccine, then I would view that just like any other compliance issue with policy. That's an opportunity for them to find a place that is more open to not expecting them to support a healthful work environment.
So, so do you foresee telecommuting practices changing? I guess once there is a vaccine, or do you think that people? I mean, I think that you've talked to me about how you feel that you've gotten more productivity out of employees being remote work. So do you see kind of any of these telecommuting practices and changing?
So For associations who have already empowered their workforce to do remote work, I would be surprised if a lot of them who have successfully adopted that culture already see a major difference here. My team has been very productive. I think that's a combination of what we've done to empower them to be productive, but also what our organization's members' role in the current environment is. That creates a lot of additional work for us. Those of us in healthcare organizations generally are seeing more demand for production, and we've definitely seen that happen, even with people working from home, even after they have figured out how to deal with getting their kids, education tended to, working with
Yeah.
spouses, sharing a house with everybody.
Yeah.
Fair chance you're going to hear my dogs in the next 20 minutes. But even with all of that, we've seen people be more productive. And I'd be surprised if organizations that have embraced a culture that allows people to work where they are aren't seeing at least consistent productivity with what they would have seen before. And this has, I think, been an opportunity for not just associations, but all of businesses to be educated on sort of the value of flexibility in how you see your workforce. And so that'll be hard for some who are going to hold on to the idea that people have to be in a place to do work. And so there are certainly jobs for which that is absolutely the case. I don't think the majority of association professionals are in jobs like that. And so I personally hope, and I do think that we'll see a shift towards much more friendly work from home policies and distance working policies, much less emphasis on the amount of personal space that is committed to individual employees in an office, and possibly more hoteling and shared office space. Again, presuming you can make that safe, which I think will have a whole new lens put on it at the end of this, with organizations that are already doing a lot of hoteling and a lot of shared office space. There's many different aspects of that are now suddenly a concern. But there are ways that you could handle those through sanitation protocols, through use protocols. And I think if you did that, you're great. But yeah, anyway, I'd be surprised if we don't see the shift toward telework and work from home, or work from wherever location, just becoming the norm.
Yeah. So the Society of Critical Care Medicine, they actually have, you can work from home or you can work from the office. Not now, you can't, they're not having their staff go back until at least January 2021. They've already made that decision. But prior to the pandemic, they already had a policy of, you can come to the office and you basically have to kind of your in the office calendar. They had an in the office calendar and you signed up for your space. They also have pandemic protocols they had already had, which is actually posted on our website as well at orgsource.com/real solutions. And so they actually have a protocol of, if you have to go in the office, how to wipe down the space that you're going to use, et cetera, and how you end up leaving the office. So, but it was interesting. I had a call with another CEO last week, and they said, our building downtown is opening. I'm not having my staff go back until the end of the year at least. He said, but we have staff that have like 4 people living in a small apartment that never plan to all be working and living there together because, they've got young staff. He's like, so I am going to allow them, if they want to, go to the building. And then he'll have some kind of protocol of what that means and what that looks like, just to let them kind of get out of their small apartment. So I think some of us are all feeling that a little bit, right?
Yeah, and I think there's an important distinction there between the expectation and the opportunity that is being presented. So on the one hand, if the expectation is that people come back to the office, that puts a burden on them. On the other, there's the opportunity and the flexibility that you can offer, and that's since we're not mandated to keep people at home, our phase 3 protocol gives our staff that same ability, that if for whatever reason they just can't get what they need to get done outside of the office, then the office is now available for them to do that. And I know I've got a few employees that are going to take us up on that ability once it's available. So yeah, I mean, and that's a really good, more inclusive way to think about that, is remembering their home environment may not necessarily be conducive to them being productive.
Right. Yeah, so that's great. Thanks, Bill. Let me see a couple more questions. So can you discuss the need for masks in an open office that have no cubicle walls?
Absolutely, they're needed.
Yeah.
Yeah, there's without a doubt. If you have adopted the very chic, very modern open office plan where you have basically picnic tables throughout your suite and people sitting 3 or 4 feet apart and sharing all of that air directly with no real ability to filter it, and probably don't have a negative or a positive pressure or negative pressure air system. Um, a mask is basically the only thing you have. I think there's a lot that you'd want to do with those spaces and with space generally. I talked a little bit about our space, and so we don't have enough people for this to be a problem. But if you have these open plans where there's different traffic patterns and whatnot, sit down with your building manager, your space manager, or whoever your office services teams are, the same folks that are part of your evacuation plan development and safety plan development should be a part of this, and look at the traffic patterns you have. Get some plans out on the computer and figure out what a 6-foot circle looks like in your floor plan, and think that at no point in time should you ever expect 2 people to occupy the space of that circle, and see what that does to how people can sit where and what chairs you should then remove from the environment so that you could keep people away from that. Um, there's a lot of considerations there, but if you are going to make that available to them and people are naturally going to congregate, the mask is really kind of that last step, that is that last layer of protection. A lot of discussion has gone into the efficacy of wearing a face mask, even especially the cloth masks that you see most people walking around with. And it really is, while not a perfect solution for protection, it contributes as part of a system of behaviors and protocols to a considerable lessening of risk of transmission. And so if you care about people not getting sick, then require them to wear a mask. It's pretty straightforward. So for me, I don't see controversy in that.
All right, great, thanks. So we're headed up to 3 o'clock, but since so many people are still on the webinar and there's so many questions coming in, do you mind hanging out with us for another 10 minutes?
Sure, no problem.
All right, great. So, it was, I don't think. So somebody asked, will OSHA create a summary of their 70 plus pages of non-committal potential recommendations?
Somebody, yeah.
Somebody.
Actually, so OSHA has actually put out a tremendous amount of material. It's and I've seen. I think I know the document that they are referring to. I was able to find a briefer version of what to do that I could probably put a link out for. The briefer version is 30 pages. So in typical OSHA fashion, it's a little bit. It's the bullet points of the 70-page document that still gets us to 30 pages. So yes, they do. We've been in touch with OSHA, and they're doing what OSHA does, and they do it very well. And sometimes that is more directly applicable than others, and depends on what you're doing.
Yeah, great. So I have a very tactical question, and it's an interesting one because I was watching I guess because we work with so many medical societies, I was watching way too many webinars from our different subspecialty groups. And one of the doctors said, I'm not worried about getting COVID-19 from a patient. I'm worried about going into the break room where everybody's touching the microwaves and whatever, the refrigerator, and they're not wearing masks, and we're congregating. He goes, I feel like I could probably get something from, one of the other docs. So can you talk about like how organizations should handle like the microwaves, the water machines, all that sort of thing?
Yes. Well, it's funny you mentioned, if you download everybody that downloads the presentation will see kind of how we're approaching that. We're limiting the number of people in our kitchens. Our kitchens are small. They're about 10 or 11 by 10 or 11, they're roughly squares. We have 2 of them because of the way our suite is configured. And each has appliances and different shared use items. We went to a good amount of effort to think about how those get used and put in place requirements that if you're going to use an appliance, decontaminate it before you use it, decontaminate it when you're done. And that counts for the microwave, the toaster oven, coffee, everything. All of those things need to be a part of that. We banned the use of our dishwasher and leaving it, anything in the sink, because really all that does is defer a contamination problem for somebody else. We also, to the extent that you can, use disposable plateware and dishware when you're using that, so that you don't have another item that is persisting in a place with your ability to have cleaned it properly, so that it reduces that risk even more. And that's even true if you're using your own water bottle or your own plate or your own bowl. People tend to get comfortable with stuff that is where they don't think they're on the clock. If they feel like it's a place to relax, or if they feel like it's something that they normally are going to get comfort from, they lower their guard a little bit. And so I'd say that your kitchens, your lounges, your bathrooms are actually the place where this stuff becomes the most important, because people stop thinking about it there because they're in there to do something else, or they're easily distracted while they're in those as you're thinking about making your workplace safe, I would pay maybe a little bit more attention to those kind of spaces than you would somebody's personal workspace. Everybody knows that they should be disinfecting their phone and their keyboard. That they probably do that anyway. But everybody kind of assumes those common spaces are handled by somebody else, and they haven't developed the habits personally of doing that in most places.
Great. And Kevin just threw up the QR code for the resources that we're talking about. If you have a phone handy and you pull up the camera and hover over the QR code, it'll take you straight to the page. So one last question, Bill. Nancy says, love the thinking around the opportunity versus expectations in terms of where you work, either the home or office. So thinking about the impact on employee culture on the longer term work from home environment or fully optional work from home environment, any thoughts on how you keep culture engaged in a hybrid environment?
I think we're all learning as we go. One thing that we've done at AECOM is we have every Friday we have a half an hour coffee talk kind of thing, encouraging people to get on Zoom and encouraging people to actually use the camera so that you can have something like a human connection with the people that you're working with. But it's probably a good idea to have regular interaction with people about how their organization's culture may actually need to shift, or maybe need to improve or incorporate these new work styles. If you have a work culture where people get things done by impromptu congregation in a hallway, then you're going to have a real challenge if suddenly a third of those people are not in that place to have that conversation. And so you need to think about how to have a simulacrum of that provides the same kind of value or the same kind of service. And some people are going to adapt to that very well, some people are not. And that will be something that is going to be a challenge for organizations. I think in the future, we're going to see a lot more of assumed ability to just roll this in to the work culture. Some recent interviewing that I've done, right out of the gate, I was asked about, what are my thoughts around remote work? And right now, it's like, yeah, do it, please. But as part of the team, I think because we had done our digital transformation and we had shifted everything very easily into work from home, our team is going to be pretty good about, okay, great. So we have somebody who's on Zoom now. Our office protocol, we say that even once we get back to full steam, and everybody is working and people can come back to the office even if they're not required, it'll be a long time before I don't require a Zoom meeting for a meeting of more than 4 people, just because that gives people the personal space. So I don't care if there's 7 people in the office. If if 6 of them need to be in a meeting together, they'll jump on Zoom, because you could do that, and that's safer than if you're actually in the actual space. But the best thing would be, if you see yourself facing that sort of transition, or the need for that, or the lack of comfort from one side to the other, foster the communication, have that conversation happen where employees that are pro and against this can express their opinions, and hopefully come to an understanding of why it is better to shift.
Great. Well, thank you so much for your time today, Bill. This was, I think, is very helpful for folks. If you guys want to connect with me, again, with the QR code, you can do that, or connect with me on LinkedIn/in/Sherry B. And or if you want to set up a consultation, again, I'm doing 30-minute consultations for anybody who wants just to kind of talk through what your next steps are, either from moving to the office or any other areas. And we appreciate everybody's time. We will have another